I'm Shannon Fox-Levine. I'm a pediatrician, and I've been a pediatrician now for over 20 years. I'm a board member for our Florida State American Academy of Pediatrics chapter. I'm the president of our Palm Beach County Pediatric Society, and I have been now for over 10 years. Where I get my passion from is making a difference in children's, adolescents, young adults, families' lives. As I get older, that's what I realize my real core is. And it's taken me this long to figure that out, but I feel like I was just fortunate that I carried on this path from starting from residency and then coming out into what we call the real world of medicine in practice and seeing it firsthand, becoming a part of families. And now I've been here for 22 years, and so I've raised a generation. I think it was commonly understood that the brain-body connection is one. We weren't necessarily trained that way, but you experience it. I mean, mental health is my big thing. And I think with mental health, the key is that what we give at Bluebird Kids is comprehensive care. So it's not physical care or mental care, it's care of the whole child. So that's kind of that concept, is that I think people oftentimes separating out mental health from physical health, but there's really no separation. It's the body and the brain, all one. Prevention is, not just giving vaccines, which is so important to keep kids healthy and to keep our community healthy, but also screening for mental health risk factors that could then eventually cause actual physical medical conditions when they're adults. So I'm very passionate about that, mission driven, to get the word out, to educate as many, whoever will listen. So where we used to be very focused with families on those visits, with the 5-year-old talking about whether they eat their fruits and vegetables, now it's kind of talking about a little bit that variety is the spice in life. So you want to eat a little bit of everything every day, eat all the colors of the rainbow, and we talk about that. But part of that is, do you eat a meal together so that you can have this conversation together, so you can tell your guardians, parents, even older siblings, what you've had to eat today and what colors you've eaten today. And so that's the relational health component, where you're having the families kind of scratch their head to say, oh, okay, yeah, let's try to find a time together that we can eat as a family, whatever that family looks like, because it can be different for everybody. One piece of advice I would give parents or caregivers is to look at your children as individuals and not to have one basic rule for everybody in the household, but to really treat them, as their own special human, because they are.